Hi, and welcome to a Sense of Wellness podcast, inspiring and empowering a healthier you. I'm your host, Susan Greeley, and I'll be diving deeper into the 4 pillars of wellness: sleep, exercise, nutrition, and stress management. Today, I'm focused on the foundational pillar of health, sleep. I'm talking with my guest, Dr. Sahil Chopra, who is the co-founder and chief medical officer at Empower Sleep. Dr. Chopra is a distinguished physician who specializes in several areas, including internal medicine, where he was at UCLA, pulmonary diseases and critical care medicine from Loma Linda, California, and then sleep medicine from Harvard. So Sahil, thank you for joining me today.
No, thank you so much, Susan, for having me. I'm excited about our conversation today.
I really am too, of course. You have such diverse experiences as a physician alone, and I believe all of it led you to find your passion for sleep medicine and helping people live longer, more vital lives. So can you please tell us about your path to becoming an expert in personalized sleep care?
Yeah, no, absolutely. And I think the more you learn of different specialties, the more you realize you don't know. And it allows one to then build like a foundation of a more holistic healthcare model versus just having tubular vision into one specialty and thinking that is everything that one needs to know. So it's been an exciting journey. I have pretty humble beginnings. I went to med school in India. I did my residency in internal medicine, as you mentioned, at UCLA. And I was always very attracted to like complicated physiology. And we find a lot of that complex physiology in the intensive care unit, where you take care of like the sickest patients in the hospital, and gravitated towards pulmonary and critical care medicine. And it wasn't until my pulmonary fellowship where there's a big overlap between sleep problem called sleep apnea, which is a respiratory problem during sleep. So it overlaps with pulmonary medicine. And I became aware of what sleep apnea was and sleep medicine as a field, and thought that was fascinating at the time of when consumer grade wearables are on the rise. And I just thought, hey, there's something really interesting to learn in the world of sleep medicine, and ended up doing a sleep medicine fellowship. And those guys opened my eyes to how strong of a lever sleep is for our overall well-being, and how it kind of sets the foundation of our general health. If the processes of sleep are efficient, then everything we do is more efficient. If the process of sleep is broken, then everything else we do is not as efficient. So it's really exciting to be able to learn about sleep and share this with other patients.
And it's broken for so many people, isn't it? I think that's what you've obviously witnessed firsthand, and even you yourself working in intensive care. I think that you had this experience where you weren't getting adequate sleep. And I'm guessing you weren't functioning at your best, ironically, when it's needed most.
Yeah, no, totally. It's actually well described when people are in residency or fellowship, how the likelihood of them doing mistakes is higher after they've been at the hospital for longer than 18 hours in a row. And there's plenty of data that supports how important sleep is, whether you're a clinician or a first responder or a parent, anything of that nature. If someone sleeps well, then everything else starts to fall into place.
That is so true. And I said it at the start that sleep is foundational. And I say this a lot because it really is. And I focus on these 4 pillars of wellness, with nutrition being my background. I can assure you, and you and I were talking a little bit before recording about, as a parent, how that has made me prioritize my sleep as well. And so I say it's a superpower. It really is. That said, it seems like it's such a natural thing for all humans, yet millions and millions of people struggle with getting good sleep. But tell us, why is sleep important, Sahil? What is happening in our bodies, and really, why is sleep so important for us?
What happens during sleep, our understanding of it comes from a mix of some understanding of physiology, as well as our understanding of what happens to people when they don't sleep well. And from just a very high level view, people who don't sleep well, they die earlier. It's as like simple as that. Like, wow. Lifespan, health span is shorter in people who are poor sleepers as compared to people who are healthy sleepers. So that's super simple to understand. But what happens during sleep, one framework to start having is sleep is just a window during which multiple processes are happening. In the brain, like blood flow is at its peak during stages of deep sleep, filtering proteins like beta amyloid, which is a precursor for Alzheimer's disease or cognitive impairment. During sleep, the brain filters a protein called adenosine, which builds up during the day and it makes us sleepy at nighttime. Caffeine inhibits adenosine. So you can start seeing how, like, when people drink coffee, how they're able to stay awake a little bit longer. From a memory standpoint, sleep allows us to reinforce our memories, have more emotional stability. From a cardiovascular standpoint, during sleep, blood pressure is supposed to drop. So people who don't sleep well and have elevated blood pressure during sleep, they're at a higher risk of cardiovascular diseases like hypertension. During sleep, from a metabolic and hormonal standpoint, hormones like growth hormone rise. So people who don't sleep as well, they don't have as much growth hormone as they would if they slept well. From an insulin sensitivity, insulin resistance standpoint, people who don't sleep, they have more insulin resistance. So there's a whole host of things in each organ system that happens. There are clock genes in all of the individual organ systems. So when those organ systems are transitioning from the processes of the biologic day of daytime to the processes of the biologic night of nighttime, everything shifts. So I share this background because we don't completely understand exactly what happens during sleep. We're still trying to figure this out. But we do know what happens when you don't sleep well and how it kind of sets the foundation of our overall physiology during the day. Our overall physiology during the day is dictated by what is our physiology at nighttime.
That makes a lot of sense. And I know this, and I tell people that you also then during the day need to spend time really taking into account your habits during the day to set yourself up for good sleep. And it's this kind of ongoing cycle and feedback loop. So many thoughts there about hormones and circadian rhythms and getting enough sunlight. It's like, where to begin? I guess one of my questions is directly related to what I deal with a lot, which is weight management and gut health. I often say that lack of sleep then alters your gut bacteria, which then can lead to poor weight management. But what happens first? Is it we have altered gut bacteria that then leads to impaired sleep, or does impaired sleep lead to altered gut bacteria? It's very confusing. And so where does somebody focus first? On their gut health, on fixing their sleep, on trying to lose weight, right? Like it's all tied together.
Yeah. Like many of these things are tied together. And the honest answer is, I don't think we know.
Okay. Yeah. I get confused in trying to lead people in the right direction of what to focus on first.
Exactly. And one of the things about sleep is that sleep has a bi-directional relationship with so many other conditions. And for example, if someone has reflux disease or irritable bowel syndrome or any of those GI disorders, sometimes you can see that in their sleep. Like they will have more arousals during sleep as compared to somebody who doesn't have those problems. And then you also observe people who have poor sleep. They sometimes have more GI issues as compared to people who are healthy sleepers. And how this all ties together, I don't think we completely know. But what we do know is when you address different conditions in parallel in a holistic way, overall health becomes better. I think that would be I would invite people to think about it that way. Instead of being focused on like a causal relationship, it's like, let's just focus on both and let's see what happens at the end of this.
Mm-hmm. Okay. So you put together sleep solutions, very personalized sleep solutions, I believe, right? So I was curious, and you track data, you track people over time. What all goes into your assessment and your sleep solution? And so what are you looking at to improve individual outcomes?
I guess let's take a step back, because I think if we understand how sleep care is today, it becomes easier to imagine what could an ideal sleep care program look like. And what happens today is people if they want to develop a deeper understanding of their sleep, this happens either through some kind of a consumer grade wearable, which is a phenomenal tool to drive insights. Yeah, I see you're wearing an Oura ring. The other way to do this from a medical standpoint is to do what's called a polysomnogram. The short term for this is PSG. These PSGs can happen either at home or they can happen in a lab. And for those of us who do wear a consumer grade wearable, what we observe is that our sleep is very dynamic on a night to night basis. And if our sleep physiology is dynamic on a night to night basis, well, guess what? Your pathology of sleep too will be dynamic on a night to night basis. So if someone has a sleep disorder, some nights they may have it, sometimes they may not. If they do have it, the severity of burden of that disease will change. They may have mild sleep apnea one night, severe sleep apnea the other. They may have mild restless legs one night, severe restless legs the other. So when you become aware of that, the idea of doing a one night sleep test, it doesn't make sense anymore. And if you imagine what could amazing sleep care look like, a foundational component of this is it has to have longitudinal data about some individual that allows us to understand their sleep trends rather than like a sleep snapshot. So when we think about sleep, we're thinking about this across trends, sort of like what continuous glucose monitors have done for diabetes care. Taking care of somebody who has a CGM is very different. One approaches them very differently than if you just have hemoglobin A1Cs. Similarly, when you have someone's sleep data across time, you can approach it in a fundamentally different way as compared to if you just have a one-night snapshot. So the idea of then solutions are tailored to data and symptoms rather than like a one-night sleep study where you just have some information about their sleep. And what that unlocks is like the ability to provide personalized care, the ability to understand how different behaviors, environments, thoughts influence one's sleep, whether that's lighting, a late meal, thoughts about insomnia, temperature, humidity, mattress, curtains, all of these like behavioral, environmental things, all the way up to if they have sleep apnea, what happens with a breathe right strip or mouth tape or sleeping on your side or a CPAP machine, or if they have restless legs, what does something like a Theragun do to someone when they have restless legs? Or what does a sitz bath or relaxing before stretching exercises do to their RLS objectively and subjectively before sleep? So it unlocks this like can of worms of how do you mix and match now solutions personalized to this individual and track objectively and subjectively what is happening to them over a period of months. So like there's no magic pill here. It's really like understanding someone's physiology and then having protocols to tailor a solution that is custom to them.
Mm-hmm. So it really is non-prescriptive, yet you do have some protocols that, and then people fall into, it's more nuanced. And I know that with all this data and tracking. So when does somebody come to see you? How do they know that their sleep deprivation is becoming a problem? It's not just sleep apnea or self-diagnosed insomnia, right? Like when do people need help?
The way that I sort of invite patients to think about this, well, patients come to us either from their doctor, they'll refer them to us, or the patients themselves know something is not correct based off of the wearable that they are using that consistently tells them that your sleep health is not as healthy as it should be for your age. Or the patients, they screen positive for any one of these like questions where they have a difficult time falling asleep. And this is consistently, not like on a one night basis, but on a consistent basis for weeks to months. They either have a hard time falling asleep, they have a hard time staying asleep, they wake up unrested the next day, or they just feel tired for unclear reasons during the day. And I think if someone screens positive for any one of these 4 questions, that deserves a sleep test. The other reason to do like a sleep health assessment is if they have any other condition like diabetes that is difficult to control, or they have anxiety or depression that is refractory or requiring multiple medications, or if they have atrial fibrillation, some cardiac disease, or if they are concerned for Alzheimer's disease, cognitive impairment, or if they're on testosterone replacement therapy because their testosterone is low. So like once you understand like what's the function of sleep, anytime any of those downstream things are broken, that also becomes a reason to go back to say, hey, let me just make sure my sleep is as healthy as it can be because I have this sort of possible consequence of a long-term sleep disorder.
Mm-hmm. Back to being that foundation. So we do live in this era of health tech and health data. I think it all really helps to improve and personalize, obviously, everybody's health journey, basically. But what do you recommend for listeners, for the layperson, as far as tracking sleep? Do you think we should all be tracking our sleep?
If tracking something does not cause anxiety,
okay,
then I think it's worth tracking.
That's a great point, because I know any of these wearables can actually cause more stress and anxiety in people. Like CGMs, I've seen it. I have seen it with the sleep data. They thought they slept well, and then it shows that they don't. So they get very stressed by that. Okay. But that aside, don't you find them to be helpful for people to figure out for themselves too what is impacting their sleep?
Yeah, no, I think it's a really powerful and very empowering to know your own physiologic biomarkers so that you can make lifestyle changes, assuming you are motivated. It's like sometimes people may not be as motivated, or there's notification fatigue that happens from getting flagged all the time that something is abnormal. But I do believe that this information is super helpful for one to understand their own physiology so that they can eventually make choices that can allow them to live a longer and healthier life, assuming that's their goal. And I think if you understand the goal, then figuring out what are the things to track over a period of time, it becomes a lot clearer to do that.
We'll take deep sleep. Let's focus specifically on that one aspect of sleep, because I've seen this with several, I won't say many, but quite a few clients that I've worked with. They're tracking with an Oura Ring specifically, and they see that they get almost no deep sleep. And then what do you do with that information? They think they've slept well. So how important is deep sleep? And what would you say to somebody who shows that they had somewhere between 4 minutes and 10 minutes of deep sleep per night? When is it really a problem? Back to, they know they want to live long, right? They're willing to change if they find out that there is something to do that can help them get better deep sleep.
It kind of comes down to what is the age and what are the other medical conditions that are at play because a 25-year-old physiologically will have more deep sleep versus a 75-year-old. As we get older, sleep breaks apart, just like our physiology does. So to assume that an 85-year-old or a 75-year-old will have the same kind of sleep, they would have likely been a much better sleeper at the age of 25, but sleep health too declines over time. So it's really important to put like numbers into context of age and medical comorbidities and medications that they may be on and their overall social environmental context. And I think then once you have that information, you can approach this with some kind of recommendation, because there are medications that cause a reduction in deep sleep. Some of the antidepressants do that. They may have lifestyle changes. They may have a lifestyle where they're eating too late in the evening or consuming too much television content, or they may be doing things that are wake promoting during the window when we should be doing things that are sleep promoting. Or they may have a lot of stress, anxiety, which also reduces the amount of deep sleep. So it's hard to give like these one-off like statements or recommendations of this is what you need to do if any of these numbers are abnormal. It'll be a statement that doesn't necessarily work for that individual.
Yeah, that makes a lot of sense to then follow their own trends and see when it does vary, of course. So you do that with your patients, clients.
Yeah, exactly.
You get into the weeds of all the behavioral and lifestyle aspects.
We get into everything that can possibly influence your sleep in a positive or negative way. And we do what are called sleep experiments, where if you're motivated enough to make changes in your lifestyle, let's do 1 week of abstaining from something that is conducive to wakefulness or doing something that is conducive to sleep. Let's incorporate this behavior or intervention or supplement or medication or whatever that may be. And let's see what happens to your numbers. And it's kind of a journey of over 3 to 6 months trying to help people get to as good of sleep as physiologically possible in this setting, in the diseases, in the age group, in the medications that they have to be on.
Nice. Okay, so out of everything you mentioned, we're talking behavior and environment and all these controllable lifestyle factors. Something that comes up very, very frequently for me and people I work with are supplements. So there are so many different popular sleep supplements, everything from melatonin and magnesium and many others actually that are a combination. Is there any one single supplement that you try in that experimentation that you're doing with, called their personal experimentation? Do you reach for specific supplements? Do you find them helpful? Are there any that are your go-to or that are incorporated into your protocols?
It's hard to pinpoint a specific supplement. I'm very open about them, and I'll ask the patient that if you want to try these different supplements, you're welcome to do so, and let's see what happens over a course of 4 weeks or something of that nature. But my anecdotal experience has been, because most of our patients have a complex physiology, they're not in the window of there is something deficient, so I'm going to replete it with a supplement, but there's true pathology with their sleep that needs to be addressed in a more scientific and medical way. And it's been hard for at least me anecdotally to see if a specific supplement objectively and subjectively has improved one's sleep. Melatonin does help, 0.5 to 1 milligram, like low dose melatonin in the setting of jet lag or circadian rhythm disruption. We can actually do what's called a melatonin profile where you measure one's endogenous melatonin level. It's a salivary test over a 24-hour period. And you can measure like, hey, does this person make enough melatonin like they're supposed to? Or their peak and trough of melatonin, is it within the right window that it's supposed to be? So if there's a deficiency in those situations, I think it makes sense to be on a specific supplement. But blindly staying on supplements is something that I'm not necessarily like a big fan of, unless it subjectively makes one feel better or objectively is moving the needle. Mm-hmm. But there's not one specific thing that we sort of jump to.
There's not. Okay. That's very helpful. Consumers are out there reaching for a variety of supplements and self-treating and Googling and all of that, right? I know a lot of people who just automatically reach for melatonin.
Yeah. It's not ideal. If you go to your doctor and you say, I have knee pain, they're not going to give you a Norco or a Vicodin, or like they're not going to give you a narcotic for pain. They're going to say, okay, like, let me examine you. How long has this been happening? Let me get an x-ray. And then like, let's come up with a plan. I'll see you a week later and let's see what we find. But one of the things that's happened in sleep medicine, sleep complaints is, oh, you don't sleep well? Here's trazodone. You don't sleep well? Here's Ambien. You don't sleep well? Here's a benzo. You don't sleep well? Oh, go try this supplement. Or you don't sleep well? Try this mattress or blackout curtains. And it's, if we just take a minute to ask ourselves, why does one not sleep well? Then one can start peeling the layers of the onion of, okay, like this is like the potential target that we need to focus on, because this could be the root cause of why someone's not sleeping well. And when one thinks of sleep that way, it just becomes a lot easier to come up with a plan of how to address this. And a sleep test is the easiest way to understand what's happening to someone's sleep.
Mm-hmm. Thank you. That's very, very helpful. And sometimes it's a controllable and easy fix, and other times it's not. But I think the most valuable thing is, like, you and I both do work on lifestyle, and it takes time. There are really no quick fixes, whether it is with diet or sleep or exercise, right? And that's where we're saying this. But what's exciting and also, I have to say, a little nerdy about it from my perspective, I love finding new information to help people. And you said it yourself, like we don't know. We don't have all the answers. There is that mystery factor. And the cool part is that N of one, experimenting on yourself in certain areas and see what comes out. I say this to people all the time, like really be willing to put in the time. Wouldn't you say? I think that that's probably the best starting point, is approach it as this, okay, this is going to be a little bit of a journey of uncovering and self-discovery and being willing to have some things work and have some things not work, but doing that full life assessment. Now, as we're talking, it's kind of occurring to me too, that the area of sleep is where people have to be willing to reveal a lot about, and that self-awareness, reveal a lot to themselves and to their doctor about their overall life, right?
No, totally. It's so powerful for the individual from an outcome standpoint when they put in the time to improve their sleep, because so many other things in their life start to fall into a much better place.
Mm-hmm.
And it's really exciting and fulfilling to watch that happen for sure. Right? And it requires, as you mentioned, a lot of work. It's like obesity management. You can go to a bariatric surgeon and get some kind of a surgical intervention done, or buy Ozempic online. And you can go buy a CPAP online or a dental appliance online for sleep apnea. But if the goal is to improve your sleep health in a fundamentally different way, there's going to be work that one needs to put in. It requires time, it requires effort. But the good news is we're all designed to sleep. And much of what we do is taking things away rather than mixing things into the equation. And if you don't do anything, you can only stay awake for so long. And my job is to help you figure out what are all the things that need to be peeled away out of this equation of like things that you're doing, so that this normal process of evolution has designed us to fall asleep, sleep 7 to 9 hours, stay awake for the remaining of the day. Like when it's broken, it's because of something that we've done, not most of the time from a behavioral standpoint. And my job is just to help you identify those things and show you the data of what happens when you make those lifestyle changes and help you build a foundation so then you keep it that way. It's like breathing. Breathing is not supposed to be hard. If it is hard, something is wrong. And the same thing about sleep. Sleeping is not supposed to be hard. If it's hard, something is wrong, and we just need to figure this out.
Thank you. I think that's such a key point. And I've learned that along the way in doing my podcast too, talking to other sleep experts, that sleep is natural. We all have a natural ability to sleep, and that your thoughts, you mentioned that too, your thoughts, your own mindset around sleep is a big factor, isn't it? So if you believe that you can sleep, you can sleep. If you don't believe you can sleep, that negatively impacts your sleep.
Totally. It totally does negatively influence your sleep.
Yeah, it's fascinating. Okay, back to diet, since I do like to talk about diet, nutrition, and gut health and sleep, and so many things tied in there. It could be like some people snack in the middle of the night. Believe it or not, I've helped people stop their middle of the night eating, which we all know is going to lead to weight gain, poor sleep, all of that. But I wanted to ask if you incorporate nutrition and diet recommendations into your approach with people too. And, do you help them remove too much caffeine? Do you focus on foods that do contain tryptophan and melatonin? Do you talk about that with your clients as well?
We do. We talk about all of the above. We probably need to do a better job at nutritional guidance, but we do talk about stimulants such as caffeine, mitigating the amount, and by a certain time of day. And we also talk about reducing the amount of fluid or food intake at least a couple of hours before bed, not to eat a heavy meal, all of these like sort of basic things. Mm-hmm. We have not done a good job on promoting certain foods that could possibly help you sleep. I think that would be an interesting experiment for us to do. Would love to pick your brain about this later on, what are those foods that you have seen, anecdotally help people. And I think we have some really interesting tools that can measure these outcomes. But we do take a very holistic approach to this. Like, don't eat in the middle of the night, because eating in the middle of the night is actually, it's a circadian entrainer, so that it entrains our circadian rhythm. Food, exercise, light, and darkness. These all modulate our circadian rhythms. So eating in the middle of the night is not only disruptive to the process of sleep from a central nervous system standpoint, but it's also disruptive to our circadian rhythms. And so we have to talk about these things if we're trying to have like a very holistic program for a patient.
That's one of the things I've discovered in coaching people. And then some are not forthcoming with that information. So when I hate to say the word ashamed, but they don't want to admit that they're up in the middle of the night eating. So once you actually discover that or uncover that, you can work to stop that pattern, that behavior. Yeah, I've seen how damaging it actually is all around. So that's one takeaway. So if you know you're doing that, whether in secret or not, work to get the support, whatever it takes to stop that habit alone. Right?
For sure. And I'm sure some of your clients who have used a CGM, the glucose monitor, they'll be able to observe if they were to eat that same food during daylight hours, how it will result in a usually different glucose spike as compared to if they eat it in the middle of the night. So the data can help one make those decision changes and to see how it's influencing their physiology.
Full awareness. That's why I think it's a very exciting time. When I said I get a little nerdy, we have a lot more insight into what happens when, right? When we're tracking it and observing these nuanced habits of people and what we can do. As far as recommendations diet-wise, I'll bring this up because I see this a lot too. And it does get emotional. So like when you throw diet into the mix, it always becomes a little touchier than if you're talking about, say, turning off the TV at night. People like to do it, but they understand that the blue light exposure, stressful news, all that negatively impacts your sleep. But when you go and say or recommend that they remove all of their artificial sweeteners from their diet, or like, their addiction to a diet soda that they're drinking through the course of the day, they don't want to make that leap to, oh, my sleep will be better if I remove my favorite addictive diet soda. Is that funny? Like that actually comes up in coaching for me quite often. And so
what happens if you frame it in a way where instead of like one of the things that's worked for us is how one communicates with the patient. And like anytime like we'll frame it as a question, like I'm observing that you're having 10 diet sodas, for example. Are you open to, instead of having 10, like, are you open to having 9?
Right.
And many times if like a patient has made it to you already from a coaching standpoint, I would imagine that they're already open about it. And then I would imagine if they're open about it, then there is a path and a journey to de-escalation of this over time. Mm-hmm. But I do agree with you, like just telling people to do something or not do something, it doesn't work well for us. Like framing things as a question and planting that question in their own mind is pretty powerful.
Right. And empowering. And that is actually the goal here with all things health and well-being, wellness, right? Is truly to educate and empower the individuals. And sometimes people are very open from the start, and with other, everybody's different. That's why I like the non-prescriptive approach and absolutely having the sensitivity to figure out how somebody, ticks, basically, how open, receptive, and willing they are. But yeah, it's interesting in talking about this, things that people don't necessarily think about at the get-go when they say, oh, I have terrible sleep deprivation, I'm a terrible sleeper. They don't even know that it's going to get into, we'll call it a more psychological assessment of themselves and their life, right? And willingness to change in certain areas. It's fascinating.
For sure.
Yeah. I know we've been chatting a while. There's so much to this that I would like to actually discuss with you again. For today, though, I asked this of all guests. So 2 things I still want to ask you. One is, where can people seek you out and find more about Empower Sleep?
They can go to empowersleep.com, EMPOWER sleep, SLEEP.com. And they can learn more about what we do and schedule a visit online if that's something that they're interested in. And we would love to be able to take care of them.
Nice. Thank you. Okay. And my final question that I do ask of all of my guests is, what is one thing you're grateful for today?
There's so many things that I'm grateful for. This morning when I woke up, so I was on call in the hospital this weekend covering the ICU.
Wow.
I woke up and I was like, oh, my phone didn't ring all night, because usually I'll get anywhere between 3 to 10 phone calls, either from the ER or the ICU. And I looked at my phone and there was like no missed calls.
Wow.
And then I saw I was mentioning to you, we have like a 2-year-old, and I got out of bed And I was like, okay, there's no missed calls. And I saw him like sleeping next to me. So I went back and I just like cuddled next to him again to go back to sleep for about 30 minutes or so, and like got a little bit of a nap. But just, I was grateful that I could spend some more time with the baby this morning, just sort of hanging out next to him, which is something that I don't always have the opportunity of doing. So I think that's like kind of the highlight of my morning today.
Oh, that's beautiful. That's a precious moment for sure. As a parent, yeah, you have to savor those. Savor those, and then you savor your coffee. Next time we're going to talk more about coffee, food, naps. There's still a lot to talk about, but I love hearing that. Yeah. Thank you, Sahil. This was really wonderful. So many people are helped by improving their sleep. And I think as a society, and this is why I say it, and I know you and I are both very passionate about it, helping people sleep better really makes for a healthier society.
Yeah. You can't go wrong. Whatever you do in life, if your sleep is better, you will just be much more efficient at whatever it is that you're doing. It could be your thoughts, it could be your creativity, it could be performance in all aspects of life. And it's not that hard to fix. It just takes a little bit of time, effort, some guidance, and some objective measurements.
Nice. And it is fixable. That's the most important. Well, thank you again. I've really enjoyed talking to you, and I hope to have you back.
Yeah, no, likewise. Thank you. Thanks for having me, Susan.
Thank you. Thank you for taking time to join me and listen to this episode. You can find more information and subscribe to the Sense of Wellness podcast on our website at ccphp.net/sends. This show is brought to you by Castle Connolly Private Health Partners, a concierge medicine organization that partners with and supports exceptional physicians to deliver an unrivaled experience of comprehensive, collaborative, and attentive care for a preventative approach on health and optimal well-being for members. Be sure to listen in next time to the Sense of Wellness podcast, and remember, simple daily habits matter most.